Okay, I understand. I will write the entire script from the beginning, using Sleepster as the channel name, and incorporating all the expanded content we've discussed so far, while also ensuring it moves towards the 20,000 word target by adding more detail and new sections. As needed, I'll maintain the calming, informative tone and the structural elements introduction, transitions, conclusion, disclaimers of the original reference script. This will be a multi-part generation, as a 20,000 word script is too long for a single response. I will generate it section by section. Here is the first part, Sleepster. How your brain creates floaters Part 1, X Section 1, Introduction. And welcome to Sleepster. Hello there, and welcome to Sleepster, your cozy corner of curiosity where science comes with a side of serenity. Whether you're winding down after a long day, tucked under blankets with your phone propped against a pillow, or simply letting your mind float gently towards sleep, I'm so glad you're here. We aim to be your gentle guide through the fascinating intricacies of the world, providing a peaceful backdrop for relaxation and learning. Our mission is to transform complex scientific concepts into digestible, soothing narratives, perfect for unwinding. Tonight, we're setting our sights inward, embarking on a quiet, intriguing journey to explore the fascinating and sometimes peculiar science of how your brain creates floaters. We've all likely encountered them, those translucent specks, squiggly lines, or shadowy cobwebs that occasionally drift across our vision, particularly against a bright, uniform background. From the subtle dance of a single, elusive particle, to the more prominent strands that seem to follow your gaze. This is the comprehensive story of how your own internal visual system produces these common, yet often misunderstood phenomena. We'll delve deep into the intricate biological architecture of the eye, unravel the subtle mechanics of light and shadow within its delicate chambers, and uncover the truly remarkable ways your brain processes visual information, often expertly, filtering out the persistent but ultimately harmless oddities of your own internal world. It's a journey that will reveal the quiet wonders happening just behind your pupils, a secret universe of perception most of us rarely stop to consciously consider, yet one that is constantly at work. Now, I must confess, I do hope this video isn't too fascinating after all. The primary goal here at Sleepster is to help you drift off peacefully into a restful sleep. We strive to inform, yes, but always with a gentle touch, ensuring the information is engaging enough to satisfy your curiosity, without sparking too much restless thought or overstimulation. Think of it as a calming, informative whisper about the extraordinary ordinary, an invitation to a deeper, more serene understanding that ultimately leads to profound calm and tranquility. We want you to feel enlightened, yet utterly relaxed. Before we fully embark on this gentle journey into the science of floaters and the inner workings of your vision, I'd love to know where in the world you are listening from tonight. What time is it where you are? Feel free to leave a comment below and say hello. It's always such a joy to see this sleepy little community stretch across time zones and continents, connecting people from all walks of life. Your presence makes this corner of curiosity feel truly global, a shared space for quiet learning and gentle unwinding, creating a tapestry of listeners across the planet. It's a testament to how even the most subtle scientific phenomena can connect us across vast distances and different times of day, fostering a sense of shared human experience. If you find comfort and value in videos like this, those that strike a harmonious balance of equal parts knowledge and calm, a gentle tap on the like button, or a quiet subscribe helps more than you know. These small, seemingly simple actions are incredibly significant. They are the quiet gestures that directly support the many hours of meticulous research, careful writing, and a whole lot of softly whispered wonder that go into creating each episode of Sleepster. Your engagement ensures that we can continue these unique explorations, bringing light to often overlooked scientific topics in a way that truly respects the tranquility you seek and deserve. It helps our community grow and allows us to keep providing these unique blends of information and relaxation for a growing audience seeking peaceful enlightenment. And just before we delve deeper, a quick but important reminder. While this video is packed with interesting and insightful scientific information about the eye and vision, it is absolutely not medical advice. Our purpose is educational and for relaxation. If you are struggling with persistent, bothersome, or especially any sudden and significant changes in your vision, including a rapid increase in floaters or floaters accompanied by flashes of light, or any loss of your visual field, it is always best to speak to a qualified eye care professional, such as an ophthalmologist or optometrist. Your eye health is paramount, and any significant or abrupt visual disturbances warrant a prompt and thorough evaluation by a medical expert. This video is here to gently inform and help you relax, not to diagnose, treat, or replace professional medical care. Please prioritize your well-being. All right, with that understanding, let's settle in, take a breath, and begin our gentle journey into the science of those intriguing specks. Allow your body to relax deeply, your breathing to become slow and rhythmic, and your mind to gently open to the unseen, yet utterly fascinating mechanisms of your own remarkable visual system. Let the words wash over you, carrying you towards a state of serene contemplation and ultimately restful sleep. To truly understand floaters, we must first embark on a quiet, detailed exploration of the eye itself. It's not just a simple organ. It's a truly remarkable biological camera, an engineering marvel designed with astonishing precision to capture the vast and intricate world around us and translate the complex visual data into the rich, vibrant tapestry of images our brain ultimately perceives. But nestled within this intricate and delicate structure lies the stage for our topic. A key player in the story of floaters, the vitreous humor. Imagine your eye as a nearly spherical, slightly asymmetrical ball, roughly an inch, about 2.5 centimeters in diameter. This precise shape is crucial for optimal light focusing. It's encased in a tough, resilient and protective outer layer called the sclera, which is the white, opaque part of your eye. The sclera provides structural integrity, maintaining the eye's overall shape and protecting its delicate internal components from external forces. Think of it as the sturdy casing of a high-precision optical instrument. At the very front of this sphere lies the cornea, a perfectly clear, dome-shaped window. The cornea is avascular, meaning it has no blood vessels, which is essential for its transparency. It acts as the eye's primary and most powerful lens, responsible for bending or refracting incoming light rays significantly as they enter the eye. This initial bending is crucial for focusing light onto the retina. Its curvature is highly precise, and any irregularities here, even microscopic ones, can affect visual clarity. Immediately behind the cornea is a small, fluid-filled space called the anterior chamber, containing a clear liquid called aqueous humor. This fluid nourishes the cornea and lens and helps maintain intraocular pressure. Through the aqueous humor, light then passes through the pupil, which is the adjustable opening in the center of the iris. The iris, the beautifully colored part of your eye, functions like the diaphragm of a camera. It contains muscles that automatically contract and relax to control the size of the pupil, thereby regulating precisely how much light is allowed to enter the inner structures of the eye. In bright light, the pupil constricts to reduce light intake and protect the retina in dim light. It dilates to allow more light in, maximizing sensitivity. Behind the iris and pupil lies the lens, a transparent, biconvex structure. The lens is remarkable because, unlike the cornea, it can change its shape. Tiny muscles attached to the lens, ciliary muscles, contract or relax, altering the lens's curvature and thus its focal length. This process, known as accommodation, allows the eye to fine-tune the focus, enabling you to see objects clearly at various distances, from the text on a page to a distant mountain range. It's this dynamic adjustment that ensures sharp focus regardless of viewing distance. All of these preceding components, the cornea, aqueous humor, iris, pupil, and lens, work in an intricate, synchronized concert to accurately direct and focus light rays towards the very back of the eye, where the true magic of vision begins to unfold. The inner lining at the back of the eye is the retina, a thin, multi-layered sheet of neural tissue. The retina is the eye's equivalent of a film or digital sensor in a camera. It is densely packed with specialized photoreceptor cells, rods, highly sensitive to light and dark, responsible for vision in dim light, scotopic vision, and peripheral vision. There are approximately 120 million rods in each eye, cones responsible for color vision and sharp, detailed central vision, photopic vision. There are about 6 to 7 million cones, primarily concentrated in the macula, a small central area, and especially in the fovea, a tiny pit within the macula which provides the sharpest, most acute vision. When light strikes these photoreceptor cells, it triggers a complex cascade of biochemical reactions that convert the light energy into electrical signals. These signals are then processed by various layers of neurons within the retina before being transmitted via the optic nerve to the brain. The optic nerve, essentially a bundle of millions of nerve fibers, carries these electrical impulses to the visual cortex in the brain, where they are finally interpreted as the coherent images we consciously perceive. This entire intricate neural network is responsible for everything from recognizing a familiar face to appreciating the subtle nuances of a vibrant sunset. But for light to reach this critical light-sensitive retina unimpeded, the vast space between the lens and the retina needs to be perfectly, immaculately clear. And this is precisely where the vitreous humor enters our discussion, taking center stage. Having navigated the broader anatomy of the eye, let us now focus our gaze, with gentle precision, on the central character of our story, the vitreous humor. This is the largest single component of the eye by volume, elegantly filling approximately 2/3 of the entire eyeball. The vast cavity situated between the crystalline lens at the front and the light-sensitive retina at the back. Its primary defining characteristic, and indeed its most crucial function for vision, is its remarkable transparency, for light to journey unimpeded from the outside world, through the cornea and lens, and finally to the retina to form a clear image. This intermediary space must be optically pristine, and for the majority of our lives, the vitreous humor fulfills this role with effortless clarity. When we are young, the vitreous humor exists as a transparent, relatively firm gel. Its consistency is often compared to a delicate jelly, holding its shape robustly. This gel-like state is not merely due to water, though water forms its overwhelming majority. The vitreous is composed of approximately 99% water, making it one of the most hydrated tissues in the body. However, the remaining 1% is where its unique structural properties and, by extension, the genesis of floaters truly lie. This crucial 1% is a highly organized, intricate network of macromolecules, predominantly to key players, collagen fibers and hyaluronic acid HOM molecules. Imagine, if you will, this microscopic architecture, a delicate, three-dimensional scaffold, woven throughout the vast internal space of the eye. This scaffolding is meticulously constructed from ultrafine collagen fibers, specifically typed to collagen. These fibers are incredibly strong for their size, providing tensile strength and forming the intricate meshwork that gives the vitreous its gel-like consistency and structural integrity. In a perfectly pristine, youthful vitreous, these collagen fibers are evenly dispersed, almost perfectly parallel at a submicroscopic level, and oriented in such a way that they minimize any scattering of light. This precise arrangement is paramount for maintaining the optical clarity of the eye. They act as an invisible, supporting web, helping to maintain the spherical shape of the eyeball and, critically, gently supporting the delicate retina against the inner wall of the eye, preventing it from collapsing or detaching. The densest concentration of these collagen fibers is found in the peripheral regions of the vitreous, particularly at the vitreous base, the area closest to the ciliary body and ora serrata, where the retina transitions into the non-light sensitive ciliary epithelium, and also around the optic nerve head, where the vitreous has stronger, more tenacious attachments to the retina. This peripheral densification serves as an anchor, holding the main vitreous body in its designated position, while the internal structure remains a looser, more open mesh, optimized for light transmission, interspersed and intertwined within. This elaborate collagen meshwork are large, complex molecules of hyaluronic acid. This remarkable molecule belongs to a class of substances called glycosaminoglycans GAGs, which are complex carbohydrate polymers. Hyaluronic acid is often lauded in other biological contexts for its lubricating and hydrating properties, and in the vitreous it performs a similar, critical role. It possesses an extraordinary ability to attract, absorb and bind vast quantities of water molecules. A single HA molecule can hold up to 1,000 times its own weight in water. In the vitreous, the HA molecules are crucial for trapping the water component, contributing significantly to the gel's overall viscosity. It's turgor the internal pressure and firmness that helps maintain the eye's shape, and its overall volume. The symbiotic interaction between the collagen framework and the water-trapping hyaluronic acid molecules is precisely what defines the vitreous's optical clarity, its viscoelastic properties, and its initial firm, homogeneous gel-like state. They form a sophisticated, interdependent biological system. The collagen provides the resilient, flexible framework, and the hyaluronic acid effectively fills that framework with a hydrated, perfectly transparent gel. This crystalline clarity of the vitreous is something we rarely consciously acknowledge, yet it is utterly indispensable for sharp, unobstructed vision. Any opacities, even those invisible to the naked eye outside the body, within this meticulously structured gel would inevitably scatter or block light, casting disruptive shadows onto the retina, and thereby interfering with the precise, high-fidelity light signals that are then relayed to the brain. For the majority of our lives, this optical perfection is a given, and we sail through our visual world largely unaware of the silent, pristine environment within our own eyes. However, it is paramount to recognize that the vitreous humor is not a static, unchanging substance throughout our lifespan. Quite the contrary, it is a dynamic tissue that undergoes gradual, yet profound, transformations over time. It is these very changes, an inherent and unavoidable part of the natural aging process, that meticulously set the stage for the eventual appearance and perception of those familiar drifting floaters. This slow, biological evolution within the eye is a testament to the continuous remodeling and subtle shifts that characterize all living tissues. The story of most floaters, particularly those that appear in middle to later life, is inextricably linked to a natural, age-related process called vitreosyneresis. This term describes the liquefaction and structural degradation of the vitreous gel, and it is an almost universal phenomenon as we age. It typically commences in the 4th or 5th decade of life, though its onset and progression can vary considerably from one individual to another, influenced by genetics, eye shape e.g., higher prevalence in myopic or nearsighted individuals, and other health factors. The process of vitreosyneresis, hyaluronic acid depolymerization and water release. The initial step in vitreosyneresis involves the gradual breakdown or depolymerization of the large hyaluronic acid molecules. These long, complex sugar chains begin to fragment into smaller, less organized pieces. As they break down, their remarkable capacity to hold and bind water molecules significantly diminishes. Consequently, the water that was previously tightly sequestered within the HA collagen gel is released, leading to the formation of small, then progressively larger, fluid-filled pockets or lacunae within the vitreous body. This transforms the once homogeneous, firm gel into a heterogeneous mixture of liquid pockets and residual gelled areas. It's akin to a clear, firm gel slowly starting to melt and separate, with watery regions emerging amidst denser, jelly-like remnants. Collagen aggregation and condensation. As the hyaluronic acid breaks down and the tightly bound water is liberated, the delicate collagen fiber network, which previously relied on the hydrated HA to maintain its uniform dispersion, is no longer adequately supported. The collagen fibers, now unsupported and in a more aqueous environment, begin to lose their perfect alignment and instead aggregate, clump together, intertwine, and condense into progressively denser strands, sheets, or irregular masses. These, Newly formed. Optically denser structures are the physical culprits that ultimately cast the shadows we consciously perceive as floaters. These are not foreign invaders. They are simply the aggregated, visible remnants of the eye's own aging. Structural proteins. The irregular shapes of these clumps mean they will scatter light unevenly, leading to the diverse appearances of floaters from fine threads to chunky blobs. Optic cavity and movement. As this liquefaction and collagen aggregation proceed, particularly within the central and posterior vitreous, larger fluid-filled spaces develop. The collagen framework within these newly formed liquid areas becomes increasingly sparse, allowing the aggregated collagen clumps and any other suspended debris to move much more freely. Within this less viscous fluid, this increased mobility is precisely why floaters appear to swim or drift across our visual field, especially when the eye moves rapidly and then comes to rest. They are carried by the fluid currents within the liquefied vitreous and then slowly settle due to gravity. Posterior vitreous detachment (PVD), a major source of new floaters building upon vitreous. Syneresis, a very specific and dramatic age-related event, often occurs. Posterior vitreous detachment (PVD). This is a crucial distinction, as a PVD is responsible for the sudden, often alarming, onset of new and more prominent floaters in many individuals, particularly those over the age of 60. In a younger eye, the vitreous gel is firmly attached to the retina in several places, most notably around the optic nerve head where the optic nerve exits the eye, and at the vitreous base, the peripheral anterior retina. As the central vitreous undergoes syneresis and liquefies, the outer layer, or cortex, of the vitreous begins to shrink and pull away from the retina. This gradual separation is the PVD. When the PVD becomes complete, meaning the vitreous has fully detached from the optic nerve head, the ring of condensed collagen that was previously adhered to this area can become detached and visible. This specific floater is often referred to as a Weiss ring. Named after German ophthalmologist Franz Weiss, it typically appears as a large, relatively well-defined circular or oval-shaped opacity that can be quite noticeable, sometimes resembling a large O or C shape or even a fragmented cobweb. Its appearance is a definitive sign that a PVD has occurred, while its sudden presence can be startling. A Weiss ring usually signifies that the acute phase of vitreous separation in that area is complete, and the immediate risk of retinal tugging may have subsided. Symptoms associated with PVD, sudden onset of new floaters. This is the hallmark symptom. Unlike the gradual appearance of age-related wispy floaters, a PVD can cause a sudden shower of numerous, small, fine dark specks like soot or pepper, which are often cellular debris or very small collagen fragments released during the detachment process. These are frequently accompanied by the appearance of a larger, single floater, the Weiss ring, flashes of light photopsia. This is the most critical accompanying symptom and warrants immediate attention. As the vitreous gel pulls away from the retina, it can exert mechanical traction on the delicate retinal tissue. The photoreceptor cells in the retina interpret this mechanical stimulation as flashes of light. Even though no actual light has entered the eye, these flashes can be described as brief lightning streaks, shimmering lights, or sparkling sensations often noticed in the peripheral side vision, especially in dim light or darkness, or when moving the eye rapidly. The presence of flashes signifies ongoing tugging on the retina, which increases the risk of a retinal tear. Significance of PVD. The vast majority of PVDs are benign and normal, harmless part of the aging process. The vitreous eventually separates completely, and the floaters, while perhaps initially bothersome, often settle out of the central visual axis, or the brain learns to filter them out over time. As we will discuss in a later section, however, the reason PVD is a red flag symptom when accompanied by new flashes or a sudden increase in floaters is the small but significant risk of retinal complications. If the vitreous adheres particularly strongly to a weak area of the retina, the tugging during separation can cause a retinal tear. If a retinal tear occurs, fluid from the vitreous cavity can seep through the tear and get under the retina. causing it to lift away from the underlying supportive tissue, the retinal pigment epithelium and choroid that supplies it with vital oxygen and nutrients. This is a retinal detachment, a serious medical emergency that, if not treated promptly, can lead to permanent vision loss in the affected area. Therefore, while PVD itself is a natural process, the sudden onset of new floaters, particularly combined with flashes of light, serves as a crucial signal to seek an immediate and thorough eye examination. An ophthalmologist can differentiate between a benign PVD and one that has caused a retinal tear, and prompt detection of a tear allows for relatively simple, highly effective preventative treatment, avoiding the more complex and urgent surgery required for a full detachment. Now, here's where the story of floaters truly merges with the remarkable capabilities of your most complex organ, the brain. While the physical presence of vitreous opacities is undeniable, their perception, whether you notice them intensely, intermittently, or barely at all, is largely dictated by the extraordinary filtering and adaptive mechanisms of your visual cortex. Our visual system is not merely a passive recorder, a simple camera capturing every photon that enters the eye. Instead, it is an active, intelligent interpreter constantly filtering, organizing, prioritizing, and often, quite deliberately, ignoring incoming sensory data to construct a coherent, stable, and usable representation of the world around us. This active interpretation is precisely why, for many people, floaters can be intensely distracting and even anxiety-provoking when first observed, only to become largely integrated and consequently ignored over extended periods of time. This profound phenomenon is scientifically termed perceptual adaptation or sensory habituation. To truly grasp this concept, let us consider other ubiquitous, yet often consciously ignored, stimuli in your daily sensory landscape. Think about the subtle, constant pressure of the clothes on your skin. From the moment you get dressed, this sensation is always there, yet you rarely perceive it consciously, unless you actively focus on it, or if the clothing is particularly uncomfortable or new, or consider the low, persistent hum of your refrigerator in the kitchen, or the gentle background drone of distant traffic. These auditory inputs are constant, but your brain routinely filters them out, allowing you to focus on conversations or more salient sounds. Crucially, think about an even more direct visual example. You do not constantly and consciously see the bridge of your own nose, even though this physical structure is always present, obstructing a portion of your field of vision literally, positioned between your eyes and the world. Your brain, being an incredibly efficient and resource-managing organ, quickly learns that these persistent, unchanging, or highly predictable stimuli are, for all practical purposes, irrelevant to your immediate survival, your current tasks, or any new, critical information in your environment. It then actively filters them out, effectively removing them from your conscious, attentive awareness so that your cognitive resources can be conserved and directed towards processing genuinely novel, important, or changing information. This prevents your sensory system from being constantly overwhelmed by a deluge of constant, trivial, or predictable sensory input, allowing for focused attention on what truly matters. Floaters operate under this very same, sophisticated principle of neural processing. While it is true that they do exhibit movement, gracefully drifting when your eye shifts and slowly settling when it's still, their internal origin within a fluid medium and the predictable, fluid dynamics of their motion mean that they are, by their very nature, a relatively constant and unchanging presence in your visual field, particularly when averaged over time. When floaters first appear, especially if they manifest suddenly, are unusually large, or present in a new, unfamiliar pattern, they are often perceived as highly distracting. This is because your brain's inherent novelty detection system immediately flags them as new or unusual information. This triggers an attentional response, drawing your conscious awareness to their presence. This response is particularly amplified if you actively try to look at them. The more you consciously attempt to catch or focus on them with rapid eye movements saccades, The more you physically stir them up within the vitreous fluid, and the more they move erratically, making them temporarily even more noticeable and frustrating. This creates a feedback loop where trying to see them makes them more apparent, reinforcing their perceived prominence. However, as days turn into weeks and weeks into months, your brain initiates a remarkable learning process. It begins to recognize that these drifting shadows, despite their physical presence, do not represent an external threat, a moving predator or prey, an object to track, or any significant, actionable change in your external environment. They are, in essence, benign internal artifacts. As this crucial learning and recategorization occur, the brain progressively deprioritizes the neural signals originating from the retinal cells that are consistently registering these shadows. It effectively edits them out of your conscious visual experience. This does not imply that the floaters physically disappear from your eye. They remain physically present, continuing to cast their subtle shadows upon your retina. It simply means that your magnificent brain has, through continuous processing and adaptation, determined that these particular signals are not sufficiently important or informative to warrant your ongoing conscious attention. They are relegated to the background, much like the hum of the refrigerator. The effectiveness and speed of this sophisticated filtering process can, quite naturally, vary considerably from one individual to another. Some individuals possess a naturally higher tolerance for internal visual noise and are able to adapt very quickly to the presence of floaters, barely noticing them after a relatively short period. They might have a visual system that is more inherently efficient at distinguishing relevant from irrelevant stimuli. Others, particularly those who are more visually sensitive, who have a tendency towards anxiety, or who are particularly focused on their bodily sensations, may find it much harder to habituate to floaters. For these individuals, the conscious perception of floaters can persist longer and be more bothersome, potentially impacting their quality of life. Furthermore, the intrinsic characteristics of the floaters themselves play a significant role. A singular, very large, or dense floater that consistently drifts directly through the central visual axis, the fovea, might be inherently much more challenging for the brain to ignore than a multitude of smaller, more translucent specks positioned more peripherally, or those that rarely enter the direct line of sight. The density and consistency of the shadow, combined with its movement pattern, influences the brain's ability to dismiss it. Furthermore, the concept of attention plays an absolutely crucial role in the conscious perception of floaters. If you are actively, deliberately looking for floaters, for instance, by gazing intently at a clear blue sky, a pristine white wall, or a brightly illuminated blank computer screen, you will almost certainly make them visible to your conscious mind. This is because, by consciously directing your brain's vast processing resources to that specific type of internal visual input, you are effectively overriding its usual automatic filtering and suppression mechanisms. You are, in essence, telling your brain, "Hey, this is important, pay attention." Conversely, when you are deeply engaged in a visually demanding and externally focused task, such as reading an absorbing book, navigating complex traffic while driving, or performing intricate maneuvers in a sport, your brain's attentional resources are almost entirely dedicated to processing external stimuli that are crucial for successful task completion. In these scenarios, the internal shadows of floaters are much more likely to be suppressed, fading into the unnoticed background as your brain prioritizes the vital information for the task at hand. Even the fascinating phenomenon of Troxler's fading, also known as the Troxler effect, can subtly contribute to floaters disappearing from conscious perception. This is a visual illusion that occurs when one fixates intently on a particular point in their visual field for a short period of time without moving their eyes, unchanging. Non-central images in the periphery, or even just off the direct line of focus, tend to gradually fade away or disappear from conscious awareness, while floaters are not perfectly static and do drift. If they happen to settle into a relatively fixed position within a less central part of your visual field for a sustained period, When your eye is relatively still, troxler's fading can assist your brain in actively suppressing their perception, making them effectively vanish from your conscious experience. The brain simply stops registering them as new or relevant input. Understanding this remarkable adaptive ability of your brain can be profoundly reassuring for those who are persistently bothered by floaters, especially after a thorough eye examination has confirmed their benign nature. It underscores the powerful fact that what you consciously perceive as reality is not always a direct, unfiltered, or raw representation of incoming sensory data. Instead, it is a carefully constructed, dynamically edited, and often streamlined version of that data, continuously refined by your brain for efficiency and relevance. For benign floaters, your brain is, quite truly, your ultimate ally. Given time and a redirected focus, it will eventually learn to seamlessly integrate them, or make them fade into the background, allowing you to fully focus on the vibrant, complex and beautiful external world unencumbered by the subtle, drifting shadows of your internal optics. It's a powerful testament to the brain's incredible plasticity, its innate capacity for learning, and its relentless pursuit of an optimal and efficient visual experience. While the vast majority of floaters are unequivocally benign and represent a normal, even expected, part of the eye's aging process, it is of paramount importance indeed. It is absolutely critical to understand that certain specific changes in the nature or quantity of floaters, or floaters combined with other, distinct visual symptoms, can be strong indicators of serious underlying eye conditions that demand immediate medical attention. To ignore these specific red flag symptoms would be to risk potentially severe and irreversible consequences for your vision. The overarching and fundamental rule of thumb in ophthalmology regarding new visual disturbances is clear and simple. If you experience any new, sudden, rapid, or significantly altered changes in your floaters or overall vision, you must consult an eye care professional, specifically an ophthalmologist, without delay. Waiting can mean the difference between a simple, effective treatment and permanent vision loss. Let us meticulously detail the key warning signs that clearly differentiate a harmless, age-related floater from a potential medical emergency within the eye. 1. Sudden onset or rapid increase in new floaters, especially a shower. This is arguably the most common and universally recognized immediate warning sign. If you experience an abrupt, noticeable increase in the number of floaters, particularly if they appear quickly like a shower or swarm of black dots, fine specks, or new, distinct cobweb-like structures, this constitutes a major red flag. This sudden deluge of new opacities can strongly suggest several serious underlying conditions. Acute posterior vitreous detachment (PVD), as extensively discussed, APVD, while often ultimately benign, is an acute event where the vitreous gel rapidly separates from the retina. The sudden appearance of numerous new floaters, especially if accompanied by a single, prominent, often ring-shaped floater, the Weiss ring, is a classic presentation of an acute PVD. These new floaters are the microscopic debris and condensed collagen strands that are released and become mobile as the vitreous pulls away from the retinal surface. While the PVD itself is a natural process, the mechanical forces involved during this detachment phase are what raise concern for retinal integrity. Retinal tear. This is a particularly critical concern during the process of vitreous detachment. If the vitreous gel is unusually adherent to a specific area of the retina, or if the retina itself is thinned or weakened at a particular point, the mechanical tugging action of the detaching vitreous can physically tear the delicate retinal tissue. A retinal tear is a dangerous precursor because it creates an opening. Through this opening, liquefied vitreous or other intraocular fluid can then seep underneath the retina. This fluid accumulation under the retina can lift it away from its underlying supportive layers, the retinal pigment epithelium and the choroid, which provide vital blood and nutrient supply. This leads directly to a retinal detachment, which is an ophthalmic emergency. The sudden appearance of new floaters, even without other symptoms, should always prompt an examination to rule out an asymptomatic retinal tear that could progress vitreous hemorrhage. This involves bleeding into the vitreous cavity if a retinal tear occurs, or if weakened blood vessels on the retinal surface common in conditions like proliferative diabetic retinopathy, retinal vein occlusions, or even due to trauma rupture. Blood can leak directly into the clear vitreous gel. The red blood cells, though microscopic, will appear to the patient as a sudden, dense collection of numerous, fine, dark dots that some describe as soot, pepper, spider webs, or even a general haze or red tint to their vision. The density of the hemorrhage dictates the severity of visual impairment. Vitreous hemorrhage is a serious symptom because it is often associated with a retinal tear, or a more advanced stage of a retinal vascular disease, both requiring urgent assessment and treatment. 2. Flashes of light photopsia. Experiencing flashes of light, medically termed photopsia, especially those perceived in your peripheral side vision, is an absolutely critical warning sign when they appear concurrently with new floaters. These flashes are not a reflection of external light sources. They are purely internal phenomena directly caused by mechanical stimulation of the retina when the vitreous gel pulls or tugs on the delicate, light-sensitive cells of the retina. These cells are stimulated. Your brain, accustomed to interpreting stimulation of the retina as light, interprets this mechanical input as brief, illusory flashes of light. Even in complete darkness or with your eyes closed, and even though no actual photons have entered the eye, characteristics, these flashes can be described variably as brief lightning streaks, shimmering lights, sparkling sensations, or even an arc of light. They are often noticed more acutely in dim lighting conditions or complete darkness, or when the eye moves rapidly, as the vitreous has less resistance in these situations. They may persist for seconds or minutes and can occur sporadically. Significance: the presence of flashes of light unequivocally indicates that there is traction, or pulling on the retina. While this traction can be a normal and transient part of a benign PVD, it also signifies a heightened risk of a retinal tear or, subsequently, a retinal detachment. The more frequent, intense, or widespread the flashes, the greater the concern for ongoing or increasing retinal stress. Any new flashes, especially if persistent, increasing in frequency or intensity, or localized to a specific part of your visual field, warrant an immediate and urgent comprehensive eye examination by an ophthalmologist to determine the cause and rule out a retinal break. 3. A dark curtain, veil, or shadow progressively obscuring part of your vision. This symptom is perhaps the most urgent and definitive clinical sign of an unfolding retinal detachment. If you suddenly or gradually perceive a dark, expanding shadow, a curtain, or a veil moving across your field of vision, or if a significant part of your vision simply goes dark or becomes severely blurred, it indicates that a portion, or even the entirety, of your retina has physically detached and lifted away from the underlying layers, the retinal pigment epithelium and the choroid that are essential for its blood supply, oxygenation and nutritional support mechanism. When the retina detaches, its photoreceptor cells are deprived of their vital blood supply and neural connections, causing them to cease functioning correctly. The area of the visual field corresponding to the detached retina will appear dark or absent, because retinal detachment often begins in the periphery. The visual field defect may initially manifest as a shadow spreading inward from the side, top, or bottom of your vision. Significance: retinal detachment is considered a genuine medical emergency. The longer the retina remains detached, the higher the risk of irreversible damage to the photoreceptors and, consequently, permanent vision loss in the affected area. If the detachment progresses to involve the macula, the central area responsible for sharp vision, the impact on central acuity can be devastating and often less reversible even with successful reattachment surgery. Prompt surgical intervention, typically within hours to days depending on the macula's involvement, is frequently necessary to reattach the retina and preserve as much vision as possible. This symptom is not merely a distraction but a loss of part of your visual world. For sudden and significant vision loss or blurring, while common floaters can be annoying, They typically do not cause a sudden or profound blurring of central vision, unless they are extremely large, dense, and happen to be directly positioned in the fovea, the very center of the macula, responsible for sharpest vision. If you experience a sudden, noticeable decrease in overall vision clarity, a persistent and unresolving blur, or a significant dimming of vision that floaters alone would not explain, it could indicate several serious conditions: dense vitreous, hemorrhage, as noted. Substantial bleeding into the vitreous can significantly obscure light transmission to the retina, causing severe blurring or a generalized cloudiness. Retinal detachment, especially macular involvement. If a retinal detachment progresses to involve the macula, central vision will be severely impacted, leading to sudden and significant blurring or loss of your most acute vision. Acute inflammatory conditions. Certain severe intraocular inflammations, e.g., severe uveitis, can cause enough cellular debris and fluid in the vitreous to lead to significant blurring. Other acute retinal vascular events. Conditions like central retinal artery or vein occlusions, though often with other specific symptoms, can cause sudden, profound vision loss. 5. Eye pain, redness, or severe light sensitivity when accompanied by floaters. If the appearance of floaters is accompanied by other signs of eye distress such as significant eye pain, persistent redness of the eye, not just mild irritation, or severe sensitivity to light, photophobia, it could strongly suggest an underlying inflammatory condition of the eye, such as uveitis. In uveitis, the immune system mistakenly attacks parts of the eye, leading to inflammation. Inflammatory cells and protein exudates can then shed into the vitreous, causing numerous floaters that might look like dust or snowflakes, or a general haziness. This condition requires prompt medical diagnosis and targeted treatment by an ophthalmologist to manage the inflammation, reduce symptoms, and prevent potential long-term damage to ocular structures that could compromise vision. Why is prompt ophthalmic evaluation so crucial? The window of opportunity, the overriding reason for seeking immediate medical attention when these red flag symptoms appear, is the time-sensitive nature of potential underlying conditions, particularly retinal tears and detachments. Retinal tear treatment. If a retinal tear is detected early, before it progresses to a full detachment, it can often be treated with relatively simple outpatient procedures. Laser photocoagulation. A focused laser beam is used to create tiny burns around the edges of the tear, effectively welding the retina to the underlying tissue. This creates a scar that seals the tear, preventing fluid from seeping underneath and causing detachment. It's usually quick, painless, and highly successful. Cryopexy. A freezing probe is applied to the outer surface of the eye, freezing the tissue around the tear. This creates a scar that seals the tear. Both of these procedures are minimally invasive and typically prevent the progression to a full retinal detachment. Retinal detachment treatment. Once the retina has significantly detached, it typically requires more complex and invasive surgical intervention. Common surgical procedures include scleral buckle. A silicone band is surgically attached to the outside of the eye sclera and tightened, gently pushing the wall of the eye inward to indent the sclera, thereby bringing the detached retina back into contact with the underlying layers. Vitrectomy. This involves surgically removing the vitreous gel which may be pulling on the retina, and then reattaching the retina using gas or silicone oil to hold it in place while it heals. The gas or oil is eventually absorbed or removed. Pneumatic retinopexy. In some specific cases, a gas bubble is injected into the vitreous cavity, and the patient is positioned so that the bubble floats against the retinal tear, holding it closed. Laser or cryopexy is then applied. These surgeries are often successful in reattaching the retina, but the visual outcome can be less predictable and often less complete than if a tear was treated preemptively, especially if the central vision macula was involved in the detachment. The window for optimal treatment of a detached retina can be short, sometimes just hours or a few days, particularly for macula detachments. Delay can lead to irreversible photoreceptor damage and permanent vision loss. In conclusion, while the occasional long-standing floater is usually nothing to cause alarm. The integrity of your eyesight is too precious to take any chances. If your floaters are new and suddenly increase in number, if they are accompanied by flashes of light, or if you notice any form of vision loss or shadow, blur, or a curtain effect in your peripheral or central vision, please do not delay. Seek an urgent appointment with an ophthalmologist or visit an emergency room. If an immediate appointment with an eye specialist isn't readily possible, it is always, unequivocally, better to be safe than profoundly sorry when it comes to the preservation of your invaluable sense of sight. Trust your instincts and always prioritize a professional evaluation for these critical symptoms. Asterisk for the vast majority of individuals who experience floaters, particularly once a comprehensive ophthalmological examination has definitively ruled out any serious underlying conditions like retinal tears or detachments. The most commonly recommended course of action is to learn to live with them. This advice, while sometimes initially frustrating or even disheartening for those significantly bothered by their visual intrusions, is deeply rooted in a careful and pragmatic consideration of the risks versus the benefits of available interventions, essentially for a condition that is, in most cases, entirely benign and often subject to the brain's own remarkable adaptive capabilities. The medical community typically advises against invasive treatments unless the impact on an individual's daily vision and overall quality of life is truly profound and debilitating. Living with floaters successfully often involves a nuanced combination of both practical, environmental strategies and, perhaps even more importantly, a profound psychological process of adaptation and habituation. While there is no magical off switch that can instantly eliminate the physical presence of these vitreous opacities, there are numerous effective ways to significantly reduce their prominence and minimize their impact on your daily visual experience. The core challenge is not to make them disappear physically, but to make them disappear from your conscious awareness. The power of perceptual habituation revisited and enhanced. Let's re-emphasize the fundamental coping mechanism for benign floaters, perceptual habituation, as extensively discussed. Your brain possesses an extraordinary and highly evolved ability to automatically filter out unchanging or predictably repetitive visual stimuli. This remarkable neural process means that, over a period of days, weeks, or sometimes months, the floaters that initially seemed so incredibly prominent and distracting will often, quite genuinely, fade into the background of your conscious perception. This process is not instantaneous. It requires both time and, crucially, a conscious and consistent effort to actively redirect your attention away from them, actively trying to ignore them rather than compulsively chasing them with your eyes, can significantly accelerate this natural process of habituation. The more you consciously engage your visual system with external, meaningful visual tasks such as focusing on a conversation partner, observing details in a landscape, or reading engaging text, the less your brain will dedicate processing resources to and prioritize the internal, benign shadows. Your brain is a master of resource allocation, and it will prioritize what you signal to be important. Comprehensive practical strategies for minimizing visual annoyance beyond mere acceptance. There are tangible, actionable steps you can take to make floaters less noticeable in your daily life. These strategies primarily focus on manipulating the visual environment to reduce the contrast that makes floaters stand out. Strategic adjustment of lighting conditions. This is one of the simplest yet most effective interventions. Floaters are inherently most noticeable against bright, uniform, and monochromatic backgrounds because these conditions maximize the contrast between the sharp shadows cast by the opacities and the unblemished light entering your eye. Therefore, by strategically adjusting your visual environment, you can significantly lessen their apparent prominence, avoid prolonged staring at bright, plain surfaces if you find yourself gazing at a clear, cloudless blue sky, a pristine white wall, a snow-covered landscape, or a brightly illuminated, featureless digital screen. You will almost certainly perceive your floaters more intensely. Consciously shifting your gaze frequently, or even slightly changing your viewing angle, can help to disrupt the steady illumination that makes them so visible. Break up the uniform background whenever possible. For the vast majority of people experiencing floaters, particularly after serious underlying eye conditions have been definitively ruled out, the primary and most commonly recommended course of action, as we've emphasized, is a period of observation, combined with psychological adaptation, essentially learning to live with them. This advice is not given lightly, but is rooted in a meticulously weighed consideration of the potential risks versus the benefits of the available medical and surgical treatments. While specific treatments for floaters do exist, they are generally reserved for a very small percentage of individuals who experience extremely severe, debilitating, and genuinely vision-impairing floaters, where the impact on their daily life is profound and significantly compromises their functional vision, and where conservative measures have failed. It is absolutely crucial to deeply understand that any intervention aimed at treating floaters necessitates direct manipulation or alteration within the eye itself. The eye is an incredibly delicate, complex, and highly sensitive optical organ. Consequently, any invasive procedure, no matter how minimally invasive it might seem, inherently carries a spectrum of potential risks for a condition that is, in most cases, ultimately benign and often subject to spontaneous perceptual improvement or neuroadaptation. The medical community generally advises against interventions, unless the burden on the patient's quality of life is genuinely severe and outweighs the very real potential for complications that could, in some cases, be more detrimental than the floaters themselves. The decision to treat is therefore a highly individualized one, made in careful consultation with an experienced ophthalmologist. Currently, there are two primary medical approaches to directly treating floaters. 1. YAG laser vitreolysis laser floater treatment. This procedure involves the precise application of a specific type of laser to target and disrupt bothersome floaters. Mechanism of action: a YAG yttrium aluminum garnet laser is used. This is the same type of laser often employed for other ophthalmic procedures, like performing a posterior capsulotomy after cataract surgery. During vitreolysis, a highly focused, low-energy laser beam is meticulously aimed at the larger, more bothersome floaters within the vitreous cavity. The energy from the laser, when it impacts the floater, causes the collagen clump or vitreous opacity to undergo a rapid phase change. It is either vaporized, turned into gas bubbles that quickly dissipate, or fractured into much smaller, less optically significant pieces. Alternatively, the laser can be used to disrupt a floater's structure or to strategically shift its position away from the central line of sight, pushing it into the more peripheral visual field where it is less noticeable. Ideal candidates and target floaters. This treatment is typically considered suitable only for a highly selected group of patients and for specific types of floaters. Large, well-defined and dense floaters, especially the distinct Weiss ring, the large, circular, or C-shaped floater that results from a complete posterior vitreous detachment from the optic nerve head, is often an ideal target. Other dense, single, or clustered opacities that cast significant shadows are also considered. Floaters located away from critical structures. The floater must be positioned a safe distance from the delicate retina, particularly the macula, fovea, and optic nerve and the crystalline lens. If a floater is too close to these vital structures, the risk of accidental laser damage becomes unacceptably high. Floaters significantly impacting vision and quality of life. This procedure is not for individuals who are mildly annoyed or who experience only small, wispy, or translucent floaters. It is reserved for those whose floaters genuinely impair their vision, making reading, driving, or other daily activities challenging, and causing significant distress that is not resolved with time and adaptation. Advantages. Pros. Non-invasive, outpatient procedure. It is typically performed in an ophthalmologist's office or clinic setting, meaning no hospital stay is required. Local anesthesia. Only anesthetic eye drops are generally needed to numb the eye, making the procedure largely painless. Potential for significant relief for carefully selected patients and appropriate floaters. it can provide immediate and substantial improvement in vision, leading to a significant reduction in the perceived bother of floaters. Relatively quick, each session usually lasts only 10 to 20 minutes. Disadvantages and risks: cons, limited efficacy. For all types, this is not a panacea for all floaters. Diffuse, very fine, wispy, or numerous dust-like floaters are generally not suitable candidates as they are too small, too dispersed, or too numerous to target effectively with a laser. Floaters located too close to the retina or the lens are also contraindicated due to safety concerns. Multiple sessions may be required. It is common for more than one treatment session, sometimes 2 to 3, to be required to achieve satisfactory results, especially for larger or more complex floaters. Creation of new floaters. A paradoxical outcome can be the creation of new, smaller floaters. While the primary target floater may be vaporized or broken up, the process can generate new, smaller fragments that, although less dense, can still be bothersome or require further treatment. Serious complications rare but possible. While considered relatively safe in expert hands, potential serious complications, though rare, can include cataract formation, damage to the crystalline lens, particularly if the floater is anterior closer to the front of the eye, can accelerate or induce cataract development, necessitating subsequent cataract surgery. Retinal damage. If the laser beam accidentally impacts or inadvertently focuses on the retina, it can cause a retinal tear, retinal hemorrhage, or even a retinal detachment, all of which are vision-threatening events. This risk is why precise targeting and experienced surgeons are paramount. Increased intraocular pressure IOP, a temporary or, in rare cases, sustained rise in eye pressure can occur after the procedure. This needs to be monitored, as sustained high IOP could lead to glaucoma if not managed. Glare. Light sensitivity. Some patients report increased glare or light sensitivity after the procedure, often due to residual small gas bubbles or altered light scattering. Cost and availability. YAG laser vitreolysis may not be covered by all health insurance plans, as it is still considered elective or non-essential by some. Furthermore, the availability of ophthalmologists who are experienced and confident in performing this specialized procedure is limited, as it requires specific training and a high degree of precision. To vitrectomy, surgical removal of the vitreous, this is a more definitive and invasive surgical procedure where the vitreous gel, along with all the floaters contained within it, is physically removed from the eye. Mechanism of action. A vitreoretinal surgeon performs this procedure in an operating room under sterile conditions. Typically, 3 tiny incisions less than 1 millimeter each are made in the sclera, the white of the eye. Through these microscopic ports, miniature surgical instruments are inserted. A vitrectomy probe then carefully excises and aspirates, removes by suction the vitreous humor and any opacities floaters contained within it. The removed vitreous gel is then continuously replaced with a clear saline solution, a gas bubble, e.g. C3F8 or SF6, or in some cases, silicone oil. This replacement fluid helps maintain the eye's shape and internal pressure during and after the surgery. If a gas bubble is used, it will naturally be absorbed by the body over several weeks and replaced by the eye's own aqueous humor. Silicone oil typically requires a second surgery for removal at a later date. Ideal candidates and indications. Vitrectomy is a significant intraocular surgery and is almost exclusively reserved for extremely severe cases of floaters that are genuinely debilitating, causing profound and persistent visual impairment, and when other less invasive treatments or coping mechanisms have proven ineffective or unsuitable. It is most frequently performed when floaters are caused by specific, more complex conditions. Significant vitreous hemorrhage, when bleeding into the vitreous is dense and persistent, significantly obscuring vision and not clearing spontaneously. Chronic or severe inflammatory vitreous opacities. In cases of severe uveitis or other inflammatory conditions where inflammatory cells and exudates in the vitreous are causing severe, unresolving vision loss. Vitreous traction on the retina. If the vitreous is pulling significantly on the retina, causing a macular-on-retinal detachment where the central vision is still attached but threatened, or severe macular pucker edema, debilitating primary floaters only when the floaters themselves are so large, dense, and numerous that they lead to measurable and significant visual impairment and severely impact daily activities like reading, driving, or professional tasks, and the patient's quality of life is severely diminished. Advantages: pros, highly effective floater removal. Vitrectomy is the most definitive and effective method for removing floaters because the source of the shadows, the vitreous gel, and its opacities is physically removed from the eye. Patients typically report a dramatic improvement in clarity, and a complete absence of their previous floaters treats underlying issues beyond floaters. Vitrectomy can simultaneously treat other associated conditions such as retinal tears, epiretinal membranes, or macular holes, making it a versatile procedure for complex posterior segment pathologies. Disadvantages and significant risks: cons. As a major intraocular surgery, vitrectomy carries more numerous and more significant risks than laser vitreolysis, which is why it is used so sparingly for isolated floaters. Cataract formation almost guaranteed. This is by far the most common and almost universally expected complication, particularly in patients over the age of 50. The surgery can significantly accelerate the development or progression of cataracts, clouding of the eye's natural lens. Most patients undergoing vitrectomy will require subsequent cataract surgery within a few years of the vitrectomy, often within 1 to 2 years. Retinal detachment: risk of new detachment. While vitrectomy can be used to treat or prevent retinal detachment, if traction is present, the procedure itself, or events immediately following it, carries a small but real risk of causing a new retinal tear or detachment. This is due to mechanical manipulation of the vitreous, changes in intraocular pressure, or the shear removal of the vitreous, which normally provides some cushioning. The risk is typically low, e.g. 1 to 2%, but the consequence can be severe. Infection. In ophthalmitis, this is a rare, e.g. 1 in 1,000 to 2,000 cases, but devastating complication. An infection inside the eye can lead to severe and irreversible vision loss, even blindness, and requires immediate, aggressive treatment. Bleeding: vitreous hemorrhage. Minor bleeding can occur during or after surgery, which, though often self-resolving, can temporarily obscure vision and delay recovery. More significant bleeding is rare. Increased intraocular pressure, glaucoma, a temporary or, in rare cases, a sustained rise in intraocular pressure can occur, potentially leading to or exacerbating glaucoma, a condition that damages the optic nerve. This requires monitoring and sometimes medication. Visual distortions or changes. While the floaters themselves are removed, some patients might notice new types of subtle visual artifacts, distortions, or changes in their peripheral vision due to the altered optics of the eye after vitreous removal. The replacement fluid saline has different refractive properties than the original vitreous gel, and the absence of the natural vitreous can change how light scatters within the eye. Longer recovery time. Compared to laser vitreolysis, vitrectomy involves a longer and more involved recovery period, which can include several weeks of restricted activities, e.g., avoiding heavy lifting, bending over, and specific head positioning, especially if a gas bubble was used to support the retina. Why? Are treatments rare for benign floaters? The balancing act of risk and benefit, the fundamental reason that direct treatments for benign, age-related floaters are considered rare and approached with extreme caution by ophthalmologists is the highly unfavorable risk-benefit ratio for most patients. Risk profile for the vast majority of benign, age-related floaters. The potential risks of laser vitreolysis, or particularly vitrectomy with its associated risks of accelerating cataracts, inducing a new retinal detachment, or infection, are generally considered to significantly outweigh the benefits of merely removing a visual nuisance. Eye surgeons are inherently and appropriately conservative when it comes to intervening in an otherwise healthy eye, especially when the primary symptom is non-sight threatening. Their ethical and professional priority is to preserve existing vision and, crucially, to avoid iatrogenic treatment-induced complications that could permanently impair vision more severely than the floaters themselves. Natural adaptation, furthermore, as we have thoroughly discussed. The brain's remarkable capacity for perceptual adaptation and filtering often means that even initially bothersome floaters become significantly less noticeable, or even effectively disappear, from conscious perception over time without any invasive intervention. The body itself also plays a role. Some of the smaller collagen clumps can naturally break down further, and larger floaters can settle due to gravity to the inferior bottom part of the vitreous cavity, falling below the central visual axis, where they are far less bothersome. Quality of life threshold. Treatment is typically reserved for those cases where the floaters are objectively causing significant, measurable visual impairment and genuinely reducing a person's ability to perform essential daily tasks or causing severe psychological distress that is not amenable to conservative coping strategies. The subjective annoyance of floaters, while real, is generally deemed less severe than the potential for surgical complications that could lead to irreversible vision loss. In conclusion, while the idea of a simple, quick fix to get rid of floaters is immensely appealing, the current medical consensus, supported by decades of ophthalmic research and clinical experience, firmly dictates that direct treatment should be reserved for those highly selected cases where floaters are truly debilitating and are significantly impacting a person's quality of life. For the vast majority, understanding their nature, engaging in effective coping mechanisms, and patiently allowing your brain to perform its natural filtering function remains the safest, most pragmatic, and ultimately most successful approach. Your visual well-being is a treasure, and protecting it means making informed, cautious decisions in consultation with your trusted eye care professional. Even after all this time, we still look up, we still pause at the sound of wings overhead, still crane our necks to follow the silver arc of a distant airplane, still marvel at the quiet hush of a bird gliding on a breeze. Flight continues to captivate us, not because we've mastered it, but because it keeps reminding us how big the sky is and how much we've yet to understand. This enduring fascination extends far beyond the external, boundless world of flight and deep into the equally complex and utterly wondrous internal landscapes of our own perception, just as we gaze in awe at how a multi-ton aircraft seemingly defies the immutable laws of gravity. Soaring effortlessly across the heavens, so too can we find profound wonder in the intricate, silent biological processes that allow us to perceive, interpret, organize, and sometimes, quite elegantly, filter the most minute and subtle details of our internal visual experiences, such as the ephemeral and beautiful dance of floaters, from the very first tentative flapping wings of ancient insects, buzzing through primeval air over 300 million years ago, to the thunderous roar of colossal rocket engines piercing the very stratosphere and beyond into the silent vacuum of space. Flight has always been so much more than a mere means to get from one geographical place to another. It is a potent and enduring symbol, a cherished dream, a quiet, almost primal yearning etched deep into the collective fabric of our imaginations. Across cultures and generations, children instinctively stretch their arms out wide like nascent wings, mimicking the soaring birds. Artists through the ages have painted skies brimming with fantastical birds, distant stars, and ingenious machines that tirelessly climb towards the heavens. Even experienced pilots, those who routinely command incredible machines high above the earth, often speak of the profound experience of being up there as something akin to sacred, a unique solitude and unparalleled serenity, a profound sense of perspective and quiet awe that is utterly unattainable from the ground. The sky, after all, truly belongs to no single creature or country, no single species or invention. It has been shared across immense spans of time by delicate dragonflies and agile swifts, by majestic feathered dinosaurs and vast, synchronized flocks of migrating geese, by silent gliders, courageous astronauts, and perhaps one glorious day, by ordinary travelers heading into Earth orbit for a weekend escape. It is open, infinitely vast, and deeply humbling in its immensity. And in its sheer boundless possibility, it ceaselessly invites us to imagine what else, what more, might be truly possible. Similarly, the pervasive experience of floaters, while profoundly personal and inherently internal, paradoxically connects us to a universal, shared aspect of human biology and the intricate mechanics of perception. It serves as a gentle, yet persistent, reminder of the dynamic, ever-changing nature of our own bodies, even at the most minute, microscopic level, within the very structures that grant us sight, just as the external world around us is constantly teeming with movement, phenomena, and ever-shifting light. So, too are our internal physiological spaces alive with activity, often unseen, often unfelt, and often filtered by the brain's tireless work. The very presence of floaters, these tiny internal shadows, eloquently underscores the incredible complexity and often subtle, graceful imperfections inherent in the biological design of the eye and the intricate brain that processes its signals. It is a continuous, silent dance between incoming light, the casting of shadows, the fluid dynamics of the vitreous humor, and the sophisticated neural processing and filtering that allows us to ultimately perceive a coherent image. All of this, remarkably, occurs seamlessly within the confines of our own skulls, a hidden symphony of biological processes. We fly because we're intrinsically curious about what lies beyond our current horizons, about how things fundamentally work, about the absolute limits of how far we can truly go, both physically and intellectually. But we also fly because the act itself brings us intimately closer to something we can't quite articulate or name, a profound sense of freedom perhaps, an invaluable new perspective on our place in the cosmos, or simply the strange, unique, and deeply still thrill of being suspended weightlessly between the solid earth below and the silent, distant stars above. Flying is not merely a technological feat of engineering, it is, at its very core, a quintessential human one. It was a journey that demanded centuries of relentless trial and error, countless scribbled notebooks filled with audacious ideas, painstaking experiments in primitive wind tunnels, audacious leaps of faith, and incredibly precise calculations. It took generations of keen-eyed people watching birds intently, sketching their fluid forms, meticulously building odd, sometimes comical machines, and then bravely running into the wind with nothing more than unyielding hope and fragile canvas. It took an unwavering belief in the possible, a radical notion that maybe, just maybe, we too could rise, and rise, undeniably, we did, and in that very same spirit of human endeavor and biological marvel, our profound understanding of floaters stands as a testament to humanity's insatiable curiosity and the continuous, astonishing advancements in medical science. Unraveling the mystery of floaters required meticulous and patient study of the eye's delicate anatomy, a deep grasp of the fundamental physics of light, and an intricate dissection of the complex, adaptive workings of the human brain. From the earliest, rudimentary observations of drifting specks to the sophisticated, high-resolution imaging techniques and neuroscientific insights of modern ophthalmology, scientists and eye care professionals have painstakingly pieced together the comprehensive story of these common visual phenomena. This journey has transformed floaters from a source of perplexing mystery, or even anxiety, into a well-understood, recognized physiological reality. This invaluable knowledge empowers us to differentiate, with increasing precision, between the vast majority of benign floaters and those rare instances that signal a truly serious and urgent underlying condition, thereby offering profound reassurance, where it is appropriate, and initiating timely, life-preserving intervention when it is absolutely necessary. It is a quiet but deeply significant victory of scientific knowledge over uncertainty, transforming a potential source of alarm into a manageable and understood biological fact. We floated serenely in silent, hot air balloons, soared with exhilarating speed in powerful jetliners, hovered with pinpoint precision in nimble helicopters, and tumbled weightlessly in the profound vacuum of Earth orbit. We've carried sophisticated cameras to document our world, powerful telescopes to peer into distant galaxies, vital supplies to remote outposts, and the very essence of human dreams. Into the vast expanse of the sky, we've gently dropped life-giving seeds into parched lands, delivered critical aid to disaster zones, mapped the intricate contours of retreating glaciers, and gazed down in silent wonder upon the swirling, majestic cloudscapes we once could only imagine from below. Every single flight, in its own unique and profound way, tells a compelling story of relentless problem-solving, unwavering persistence, audacious reaching out, and an unyielding refusal to let gravity have the final, definitive word on human potential, even now as the miracle of flight becomes increasingly familiar, more routine, and deeply integrated into our daily lives. It has miraculously not lost one iota of its intrinsic magic. A quiet, peaceful early morning flight, watching the dawn from above the clouds, the first thunderous launch of a powerful new rocket, shaking the ground beneath your feet, a tiny hummingbird hovering impossibly still at your window, a living jewel, the sheer, breathtaking improbability of something heavier than air rising gently, silently, from a runway and gracefully vanishing into the limitless expanse of the sky. These are all moments that transcend mere explanation. They simply invite us to feel a profound and humbling sense of wonder, to be present in the awe-inspiring reality of it all. And so, here at the very end of our journey through the science of floaters and the broader marvel of vision, from the microscopic architecture of the vitreous to the brain's complex filtering mechanisms, and indeed, from the age-old dream of flight to its modern manifestations, we gently return to where we began, to the simple, yet profound act of looking and perceiving, or, in this very specific case, the simple act of seeing and deeply understanding the subtle, intricate, and often hidden world within our own eyes. Where are you listening from tonight? And what time is it in your unique part of the world? As you lie there, are you perhaps under a midnight sky richly embroidered with countless stars, inviting contemplation of the vast cosmos? Or is it the gentle hush of early morning with the soft, awakening sounds of birds just beginning to stir, signaling a new day? Perhaps you're simply winding down from a particularly busy and demanding day, letting your thoughts slowly drift upward like a solitary leaf caught in a gentle, guiding breeze, carried effortlessly by the air currents. Wherever you are, whatever the hour, thank you, truly, for spending this peaceful and informative time here with me on Sleepster. If you found comfort and value in this quiet journey through the science of your own eye and the broader tapestry of natural phenomena, I would be so immensely grateful if you'd consider leaving a gentle tap on the like button or even a quiet subscribe to the Sleepster channel for more gentle explorations like this one. Your support truly helps us continue to create these unique blends of science and serenity. I always cherish hearing from you, so please feel free to let me know in the comments where you're listening from and what time it is, as you begin to gently close your eyes and drift towards slumber. And if you find yourself still awake, gently floating on the edge of sleep, I sincerely hope that the wonder of your own internal optics, its fascinating history, its intricate science, its quiet beauty has left a soft, comforting imprint on your imagination. Whether your dreams tonight carry you through clear, expansive skies, soaring gracefully over vast, serene oceans, or simply watching the gentle tilt of the horizon as invisible wings catch the wind, may your sleep be light, boundless, and utterly peaceful. As always, this video is created purely for entertainment and relaxation purposes, offering a scientific perspective to ease your mind. It is emphatically not intended to provide any medical advice, diagnosis, or treatment. If you have any concerns about your vision or eye health, please consult a qualified healthcare professional. Thank you for watching, and until next time, keep looking up.